Hello everyone, and welcome to this audio podcast. This audio podcast as part of the lab coat. This audio podcast is part of a labostix speckle or speckle, and this audio podcast is part of a labostix syndrome. And this audio podcast is part of the click, and this audio podcast is part of a ZtormLabostix production. Through this audio podcast, I look at works and published by Mohammed and team from in around 2023. In this audio podcast, I look at a summary and around the educational support surrounding CKD or chronic kidney disease, and looking at where the original publication was a sort of a qualitative inquiry. And so in around the summary, there have been sort of initiatives such as the Clinical Trials Transformation Initiative, or CTTI, in around 2007, and the National Institute for Health Research, or NIHR, and Involve Patient and Public Involvement, PPI initiative, which sought to link clinical practices clinical practices and patient care. And whilst there have been some efforts to see a sense of integration between PPI and between PPI and in around the CTTI, it was where healthcare professionals and academic or investigators who would see a sense of advantage more so than healthcare service users or recipients. So, for example, patients or healthcare service users were not, for example, co-authors or seen as co-authors on any sort of peer-reviewed or published works, and rarely acknowledged in peer-reviewed works. And so patients were at the same time not seen as partners and collaborators in amongst where early literature or evidence sort of informs or indicates. And so this research or this publication sort of propagated the use of a qualitative methodology and a sort of a specific analytical approach, which looked to link theory with particular aspects of guidance in around particular guidance. Two workshops also took place in around 2019. In around 2019, and between the RPSG and KDOS sort of social media platforms, and in amongst this works, in amongst the publication, 19 participants between four cohorts had been involved in interviews to collate data, qualitative data, and one of the main findings of the publication was in around where there should be a sense of co-developing efforts between patients and healthcare professionals to understand how CKD education, for example, should be more integrated at point of care and aligned to public health. The pandemic did not influence the underpinning of the research, and there is still and there is and was still potential to expand in on and in around the findings of this publication. So that draws this audio podcast to a close. This audio podcast is part of the lab coat. This audio podcast is part of a Labostix speckle. This audio podcast is part of a Labostix syndrome. And this audio podcast is part of the click. And this audio podcast as part of a ZtormLabostix production.